Well, thank you, all of you, for taking the time to be here, and thank you for your extraordinary journey. We were just talking, I mean, just, what was it, 9 years ago? 11 years ago. Okay, well, you had a couple $100,000, and you had one dental chair, and here we are, walking around and meeting folks like Dr. Ruiz, and I'm sorry I pulled you out. I'm going to put you up on. So get prepared, because you're going to come up here on the mic, brother. I just met him, and we just ran back and picked him up, and he's like, oh, God, look what he's going to do to me. But you're going to understand why we want to bring him out and brag on him in a moment. But this is a pretty extraordinary place, taking care of some extraordinary people that otherwise wouldn't be taken care of. I mean, when you can meet a guy, Dr. Wood, getting a root canal, who in the middle of getting the root canal already had one shot, got up and wanted to say hello to me, not only because he was a Giants fan, but because he just wanted to say, I love coming here. This is so great. He goes, this is like, I look forward to this. An amazing doctor, and he introduced us to three of the people taking care of him, and he says that the quality of his care here is up against anything he's ever experienced. And he wouldn't otherwise have that support. He, like so many others, 90% of the folks that are here are on the Medicaid system, our Medi-Cal system in California, and they're very vulnerable to decisions being made in Washington, D.C., decisions being made in courts like the Fifth Circuit in New Orleans, to decisions being made here in Sacramento, not only at the state capitol, but at the county level as well. They're real people, real lives that are being impacted by decisions that are being made every single day all across this country. And that's why we wanted to come here and assemble each and every one of you here today. It is a remarkable thing to have the privilege of being governor of a state where people get it. Not only do they get it, but they get it done. To listen to Senator Pan, who's been a leader in this space, to have the privilege to call him Dr. Pan. I don't have to educate folks like the senator around the importance of health care, health insurance, subsidies, and those that are underinsured, not just uninsured, to have the privilege to talk about Dr. Wood, not only assembly leader in health, but someone, again, who gets it done, has those same patients, can talk about things in a granular level, an educated way, that understands the importance of expanding subsidies, not just to low-income patients, but to middle-income families. And he's been championing that for years. The fact that we were able to finally get that done is because, in many respects, the economy, but also because of the collective wisdom and leadership, not only of Dr. Pan and his support in the Senate, but people like Rob Bonta that also get it and get it done. To have that support of Senator Bonta, work that support with other folks in the Assembly to be able to create those conditions where it makes it easy for a new governor to put a budget together that does what no other state in America has ever done, and that's expand subsidies, as he says, up to 600% of federal poverty. Put that in language you may understand. That's an individual earning $72,000. That's a family earning up to $150,000. To put in perspective, what are those subsidies? They provided $450 million of subsidies. That translates to individuals $119 a month, not insignificant. For a household, it's $172 a month. That's a 23% reduction in their premiums. 23% reduction in household premiums because of their leadership. No other state in America is even talking about doing that, let alone doing that. We're proud also in the spirit of what was just said, that we're providing health care for everyone, regardless of immigration status. If you believe in universal health care, you believe in universal health care. We have sick care for everybody. We believe in health care, and we have made another incremental step towards that vision, getting it to everybody up to the age of 26, regardless of immigration status. We are on a journey to get to 100%. This was the second phase of that journey. Again, no one else in America does that. You'll continue to hear me say that. It's a point of pride and a point of privilege, but it's also a point of contrast, as it was said by a number of speakers, because as we speak, they're trying not only to vandalize the Affordable Care Act, they're trying to eliminate the Affordable Care Act. As we speak, there is a likelihood that the lower court decision will be upheld, putting at risk not just the lives of the 21 million of us in America that will lose their health insurance, and as a consequence, your premiums, every single one of you will see your premiums go up because of those 21 million losing their health insurance, but 133 million Americans will potentially be vulnerable to massive premium increases or complete disqualification of their health insurance. In fact, it's estimated of those 133 million, 52 million would simply lose their health coverage because their pre-existing condition protections would be eliminated. I ain't even gonna get into the details of those that are under coverage as children of parents that can't afford the coverage for their kids. 2 million of those will lose their health insurance. Go down the line. That's what the Trump administration's advocating for. That's their policy. They believe subtraction somehow is electoral addition. That's how perverse their policies and politics have become. Contrast that to California. There is no starker contrast. We are the most un-Trump state in America when it comes to health policy. And I'm proud of that as a Californian, not just as governor of California. This is a proud day. It's a proud budget. Is it good enough? No, and I get that. We hear that every single day. We, again, are on a journey, and it's going to take some time. But one of the things that we also recognize takes time, and that is, it's one thing to talk about care, it's another to talk about quality care. You can't talk about quality care unless you have quality providers. We often talk more about patients, not enough about providers, not enough supporting the folks that are there behind the masks. And so that's why I want to invite Dr. Ruiz up. Come on up. Sorry, brother. Because one of the other things we did in this budget that didn't get as much attention, but perhaps is one of the biggest things we did in the budget, about $2.1 billion of additional resources will be made available next year. $2.1 billion of additional resources will be made available for providers. I can go into the details of what that looks like. Well over $100 million specifically for loan repayments. One of the great burdens we have of recruiting, retaining quality care physicians and the like is to deal with the magnitude of the burden that they carry of loans. We just had an Ed McMahon moment. That is for the 6 of you that are old enough to know what the hell I'm talking about, where Dr. Galley just said, hey, hold on, and presented, there was no check though, so I want to confirm this, but told Dr. Ruiz that not only was he eligible for this loan repayment program because of the budget these assembly leaders passed, but that he just received the benefit of $300,000 reduction in his loans, leaving him with a whopping total of
$7,000.
$7,000 that he's going to have to deal with. And that ain't bad. That ain't bad. So talk a little bit about that. I mean, and by the way, he said the best thing, and for all the moms out, the best thing he ever say, he says, I got to call my mom, which is like so sweet. I don't know what happened to dads. Why aren't we ever in that? But God bless mothers. But talk a little bit about, $300,000.
Yeah.
How are you ever going to pay that back?
It was going to take me about 10 to 20 years probably to pay it back, but I actually didn't write a speech for this. I was just called up here, and it's kind of hard. It's kind of hard to talk right here next to you. It's hard. Yeah, I'm glad. I provide care for all this population, Medi-Cal, Medicaid, and I enjoy working with these patients, and it is kind of hard keeping up with those loan payments. So I'm glad I got this. $300,000 is going to go a long way. I'm probably going to be out of debt here soon, thanks to you guys. So appreciate it. You guys did a lot for me. Thank you. And I am going to call my parents, both mom and dad. Mom and dad.
I appreciate it.
Thank you.
Thank you. And you don't have to stand up here anymore. But the reason why he's eligible is because he cares about the folks behind these doors, because he cares about poor folks, cares about working folks, cares about folks that you know, a lot of other folks walk by on the streets. And he's committed his life to this kind of service. And that's what our loan repayment program's about. If you support providing quality care to Medi-Cal patients, we're going to support your journey, your story, by providing a little bit of relief on these loans. So that's the California story. I didn't bring up the $500 million of new money that health clinics are going to get for reproductive health care at a time, again, they're attacking Planned Parenthood in the Trump administration. I can talk about other aspects of this budget, but this is a healthy health care budget. It is robust. It is comprehensive. I think it was very nuanced. It was a culturally competent budget, bottom up, not top down, and a budget that can make, I think, Californians proud. But we still have a lot of work to do, and we recognize that on our way to universal coverage in California. So forgive me for being so long-winded, but this is an important day in America, important day for millions and millions of Americans. Over half of the country under the age of 65 is holding their breath, waiting for a decision of the Fifth Circuit. That's the 133 million Americans with pre-existing conditions. That's how consequential today is in this country. And so we wanted to be here to celebrate what's right in this country and contrast our approach with the approach coming out of Washington, D.C. So with that, we are here to have Rob Bonta and Jim Wood answer any of your questions. Angela.
Governor, thank you for the event today. Regardless, even if it is a long shot, if the Supreme Court does invalidate Obamacare, is the state looking at any kind of fail-safe plan or having conversations about what to do? What can the state do if this goes away?
Well, I think the application of the three-legged stool, with one leg that was eliminated, the individual mandate, was an example of our commitment to the marketplace. I mean, what a remarkable announcement today from Peter Lee. 0.84 was the weighted average increase of premiums in state of California for our exchange, less than 1%. Now, that's the weighted average. What does that mean? I want to clarify. That means some people saw reductions in premiums. Some saw modest increases. The weighted average less than 1%. Over the last 5 years, that weighted average was, interestingly, 8.4%. 0.84, 8.4. Those are actual numbers. So we've gone from average of 8.4 now to less than 1% because, and I appreciated the comments from the senator, because of our commitment to restoring the core principles of the Affordable Care Act. And so that, Angela, is our commitment in this state. To the extent that Massachusetts was able to hold up a system that became the model for the Obama administration, California is uniquely positioned to do the same. So the core tenets that were advanced in that space are the core tenets that we would explore to advance in even more nuance in detail if indeed this decision goes forward. So we're committed to our exchange, we're committed to the subsidies, but to the extent that we get impacted with millions of people that lose Medi-Cal coverage, I'm not here to say overnight that we'll be able to subsidize those losses. That would be misleading. But we would begin to rebuild that framework. And I think, again, Massachusetts offers a lot of insight into how one can do that at state level.
So the expansion population, I mean, if this goes in, if this actually is invalidated, the expansion population is at risk, is what you're saying?
Well, that's a fact across the country. And the extent that California can start to reestablish and rebuild, we will. And as you know, we're exploring more broadly. We've got this new committee that was formed, or at least reconstituted this year. And we'll be exploring all kinds of systems and models and look at the core constructs of the Bismarck Model, which everyone over here remembers Otto Bismarck fondly. built that framework for Germany's expansion, which has a lot of core tenets of California, or that beverage model, you all remember in England, how that was framed, and national health insurance. In Canada, I can bore you with other things they'll be exploring. Anybody else? My gosh, I'm going to take advantage of silence. In my business, that's good. Sorry, it's always the last one that gets you too. So, yeah.
With regards to making health insurance more affordable, and the announcements today about the very less than 1% increase, I know a lot of that was because of the mandate.
That's right.
So, do you have any sympathy for those people who are going to have to pay that tax?
Well, they were. They didn't change anything. They were paying it. They've been paying it for years. Seemed like everybody here was celebrating that a few years back when Nancy Pelosi championed her colleagues to get the votes to support the Obama administration, and we were all celebrating that. We all campaigned on it. I don't know that there was a congressional candidate in the country, Democrat, that wasn't arguing for that or an ideal that many of us share around single-payer financing. So it's consistent with that. Here's the problem. If we don't have a diverse risk pool, everybody's premiums go up. Your premium goes up, my premiums go up, everybody's premiums go up. We want to stabilize the market. We want to do what we just did, and that is substantially prove, not assert, that we can keep premiums at bay. We did that this year. Last year, you had a 24% decline in enrollment because of the elimination of the mandate. As Jim just said, you had a 5% increase, or at least the 9% increase overall, 5%, that 9% was associated with the elimination of the mandate. So we can see premiums continue to skyrocket for everybody, or we can stabilize the market, diversify it, and fulfill the tenets that all of us were celebrating, at least many of us were celebrating at the ACA, and try to replicate some of those at a state level. That's our approach. Forgive me for the long answer.
Yeah, those of us in the Alzheimer's that have been touched by Alzheimer's appreciate your support and support of the legislature.
Thank you. And we put together a task force led by former First Lady Maria Shriver. We actually just had a meeting about organizing that work group. It's going to be an impressive group. They have a specific timeline and mandate. We also have the long-term aging work group that we have organized, which is also an all-star cast. And I'm looking forward to, all these are healthcare. Healthcare is everything. Healthcare is the budget. Healthcare is your unfunded liability. It's your pension issue. It's everything. It's the reason your salary isn't higher. This is the issue that defines more issues than any other issue. And so this is why we're here. This is why we are hopeful. And this is why, regardless of what happens in Washington, D.C., California will come back strong and rebuild a framework and structure to do justice to the anxiety of this moment. Thank you guys very, very much. Thank you.